would like to think that cancer care is at the hub of what I do. That's facilitated in the hospital here because it's a smaller hospital and our contact with each other is very facilitated by the size of the hospital.
It's a very small unit, there's 3 nurses.
You know, everyone is very cohesive and the team works very well together.
There's a closeness about it that facilitates cancer care in my view.
Well, I believe that the 4 breast surgeons are excellent. I mean, you know, you would choose any of them. I think the radiologists are excellent. There's a great team working. And then as you go down through from, you know, nursing care to breast care nurse, you know, everybody, you know, works very well, I think, as part of the team, and everybody is interested, you know, and they want to do the best for the patient.
Most of us involved in cancer care have trained extensively in Ireland, the States, the UK.
And I suppose here in the Bonds, a big advantage of the unit is that it's quite private. There's a separate entrance from the main thoroughfare into the hospital. So it offers a very discreet environment, I suppose, for patients coming in. They're often very concerned and anxious.
It's rapid access. If a GP phones us today, they can get an appointment today or tomorrow.
The lady on Sunday night found a breast lump and she was with us Monday morning, you know, this kind of thing.
What's unique with the Bonds is it's so well run and we have such a good community of physicians, radiologists, etc. Within the Bonds that patients can often have many more procedures or assessments done within that visit.
I think the unit offers a very respectful, sort of dignified way of dealing with patients as well. Everything is done in one visit. It may take several hours. Usually a patient will be in the unit between 2 and 3 hours. But in that time they have their assessment and consultation with the surgeon. They have all the imaging that's required and the biopsy is taken.
We can get a number of people to see them in a very short time, and there aren't very extensive waiting lists for radiology, for chemotherapy, for assessment of heart and liver and lungs. It can be all arranged very quickly.
I will be available to come up and speak to the patients on the same day that they receive their diagnosis, which I think is something relatively unique to our hospital and which really allows the patients to move through their treatments in a timely manner.
They're seen by the surgeon, and if the surgeon feels they need to have treatment, as in a mammogram, ultrasound, biopsies, that's all done on the day that they arrive to us. And then they'll be seen by the consultant afterwards and a follow-up plan will be arranged.
And generally for a morning in the breast centre, they usually will have the vast majority of their results and know exactly where they stand.
We might know that everything looks benign, you know, you might know the consultant feels that everything's okay, but they're frightened, you know. And obviously until you get results, you can't say to the patient everything is fine.
In the background of all cancer care are the multidisciplinary meetings that go on for breast every Friday morning.
And that's attended by all of the involved specialties within the hospital. So the surgeons, the medical oncologists, radiation oncologists, the radiologists who take the X-ray pictures, and the pathologist who looks at the biopsy or aspirate sample under the microscope.
If there is something that doesn't look correct, if there's something on the mammogram or the ultrasound scan and you can't explain it on the biopsy down the microscope, that would indicate that the patient should have a repeat biopsy or perhaps surgery to remove the area if there's a concern about it. And that multidisciplinary meeting ensures the highest possible standards for the patients attended.
And we're picking up things at a lot earlier stages, so people live long after a diagnosis of breast cancer.
In terms of the vast majority of what we do is actually for benign patients, and many of them, in fact the majority, don't need any procedure from a surgical point of view.
But for patients that have a cancer diagnosed, then the process, more or less, their journey starts with us.
There are a few main modalities for treating breast cancer. The main one is probably surgery, but also at times we use chemotherapy or radiotherapy and indeed hormonal tablets, which is medication to block estrogen in effect. Now some patients need all 4 of those treatments, some people need just one. It varies, and there's an individual plan tailored towards each individual tumour and the individual patient.
So we're very proud of our extensive breast cancer clinical trial portfolio here in the Bon Secours Hospital, and I aim to make sure that there's a clinical trial option available for most patients who've been diagnosed with breast cancer.
We have a very good system set up here now, which is very close to the ideal for breast cancer treatment.
You can make a huge difference to their quality of life, as well as obviously helping to cure them from cancer, along with their other colleagues that give chemotherapy and radiotherapy.
The survival rate is excellent. So, you know, you come in and you see a lady who's very well. She gets a diagnosis of breast cancer and she really is low. And to see her coming year after year, you know, looking great and with an excellent prognosis, it's a fulfilling job.